Discussions came up in the Board of Health meeting, and I think, Marcia's had a lot of time and energy invested in tick-borne illnesses in her career. And it is an issue that I found quite interesting having moved from Chatham County. For those of you that don't know me, I worked in environmental health for many years out in the field, and I see environmental health folks here. I did not get ticks on me. As a general rule. I mean, it was a pretty rare thing. And I went through my career, I've always been an outdoors person, hunted, fished, and not really had an issue with ticks until I moved to Chatham County. And I don't know what it is, and I keep telling people, this is not normal, people. If you've lived here and you've become acclimated to it, this is not normal. Actually, for those of you that know Dr. Megan Davies, when I was working at the state, when I left, she found out I was coming to Chatham County. She says, that's the tick capital of North Carolina. I said, you got to be kidding me. Well, we moved to a small town in Goldston, and lo and behold, I start getting ticks on me, little tiny seed ticks, what everybody calls them, the larval nip stages. And it's aggravating as all get out, because those of you that have had tick bites, if you have a reaction to them, they itch for months, and and it's just so it's been a different experience for me. So, and then it got into the discussions around with the board, with Marcia, and I became more and more informed about ticks. I'd never really thought about it that much because I hadn't had that much of experience with it. You hear about the occasional tick-borne illness when somebody gets Rocky Mountain spotted fever, but it hadn't been that much of an issue. And I've asked my colleagues, other health directors, since becoming more informed about this issue, have you thought about it? Have you looked at it? And they give you a kind of a blank look. But everybody hears about mosquitoes and all this kind of stuff, and Zika virus and all these things that are in the news. But tick-borne illnesses are a reality that occur on a regular basis, and it seems to be somewhat, at least from my just general discussions with my colleagues, somewhat off the radar screen. And I'm glad to see some health directors here today. Part of the thing, just looking locally, that we had done with, I'm looking for my, we had begun looking at it and trying to get a handle on what is going on with ticks in Chatham County. So we took it upon ourselves as a local health department to do some surveys. And do we have those on the screen, or I'm just going to talk off the thing? Okay, you've got it on the back of your, let me see that one, Mike. I didn't, mine's black and white. So we did a couple of surveys. One was just a convenience survey, and that one showed, that one was done in September of 15. Chatham, we had 429 responses, and in early 17, we kind of took a different approach and asked the community college if they would help us send out a survey to all of their students and faculty, which they agreed to do. So that was sent in 2017, and we got a total of 225 responses, 65 of which were from Chatham County. So for y'all that don't know, CCC is in Lee County, which county? Harnett and Chatham. One of the questions, did you or anyone in your household find a tick on their body in the preceding year? 98% people that survey filled it out said yes. That's pretty remarkable that everybody that filled out that survey said 98% of them said they had found a tick on their body. And this is another interesting piece of information. 72% of the ones that responded that were Chatham residents, and of the ones at 98% said 72% of them, and I'm trying to get this correct, were Chatham County residents. That 98% of this. Do what? In the 2015. Oh, that's right. 98% of that. The 98% was 2015 survey. Excuse me. In the next survey, 72% of the people that said they had had a tick on them were Chatham residents, compared to 51% that were non-Chatham residents. It's interesting information that Chatham was significantly higher in reporting having had a tick on their body versus the other counties. So the other questions: what do you do to prevent ticks? 84% said they check themselves regularly for ticks on their body. 56% wear repellent. Which of the, and this is another question I found interesting, which of the diseases spread by ticks occur in the area where you live? And this goes back, I guess, to lack of information, lack of understanding. 43% said none of these, of the diseases that were listed, and there was the normal listing of all the diseases that are associated with ticks. The 43% said they didn't or didn't know. So that's a huge gap there with people understanding. Some of the quotes that came out of there: living on a farm, nearly every time I go outside in the warm months, we find ticks crawling on us or latched on. The dogs on the property are affected year-round. There was an interesting story in one of the comments. It was a really, really long comment, and this person identified as a physician, well, as a podiatrist by profession, had gotten what he believed to be a tick-borne illness, and he went through this whole iteration of how he had been to doctors, how he had sought treatment, and over time he had just gotten worse and worse. And long story, it basically put him out of his career, and he wound up having a heart transplant that he associated with the tick-borne illness. Now, but it was, I mean, he took a long, I mean, it was like a page of his story of how this had transpired. One of the respondents said, "I removed a tick from my body this morning," as he was filling out the survey. Another one says, "I'm a land surveyor, so ticks are part of the job. I found garlic pills and tea tree oil helps keep them away." From our own standpoint, and I don't know about the other counties that are here, but our environmental health, we pay to have their clothes treated with permethrin just to keep the ticks off of them. I never had to do that when I was doing field work, and I did field work in Union County when I started, and I did a lot of field work in western North Carolina and Transylvania County when I was up there for many years. Never crossed my mind to have to worry about ticks. So I don't know what it is that's going on, but there's definitely an unusual, at least from my experience, and I know Marcia's shaking her head in agreement, an unusual experience here with the number of ticks. And I'm in no way, shape, or form an expert on ticks, but it is an interesting thing. You should have on the back of your agenda this infographic about the survey. And I'll let you take a look at that. I'm not going to spend time going over it unless Mike is really the one that put it together, and I don't know if you want to comment about it. Okay. But take time to look at that, and what we'll do is, if there's any questions, just basic logistics. We have a men's restroom up here, women's restroom back there. We're going to do lunch at 12, and then there'll be a couple of lines, and so you just line up. It's buffet style, and go through and come back. And when you get seated, Marcia's going to start talking about her program during the lunch hour. And so we will move on to our first speaker, who is Dr. Carl Williams.